About 3 months ago, I was sitting in a board meeting with Ward, and we were going through another month of reporting the complexities of healthcare and the changes that have been rapidly approaching all of us in this business of healthcare over the last, particularly the last 2 to 3 years. And Ward mentioned at that time, he said, you know, it may be good for you to come in and at least shed some light on the changes and give some insight as to what's really going on behind the scenes in healthcare. And I said, sure. Little did I know that it would take on the presence it does today at that point. I know that this is a serious topic. There is no question about that. What I'd like to do today is to possibly connect the dots for you, answer the questions. What happened over the last 3 years since the Alliance came together? What is it? What are the factors and the challenges that we've been facing over the last several months and will continue as we go forward? And then possibly give you an insight as to the process that we're going through right now so that we will come out of this better and stronger. Please understand, no matter what you've heard, we are more committed than ever because of the strengths of this community to come out of the changes that are necessary for us to move forward better and stronger. We are not rolling up the sidewalk and going home. In fact, we're doing the opposite. We're positioning ourselves to accelerate, to grow in areas that are needed in this community to stabilize and become stronger. Hopefully, at the end of my remarks, you will be able to better understand what that challenge means and certainly get a sense of the commitment of the team working on this effort, yourselves included. Several years of instability among the two hospitals, as evidenced by the 3 previous years, 6, 7, and 8, all incurring operating losses. Out-migration. 50% of our community goes outside for care. Now that's not 50% of open heart surgeries. That's 50% of the care that can be provided at our hospitals in this community and provided exceptionally well. 50% of the community goes north or south. The operating losses were incurred. The community, despite attempts in the past, stepped up above the fray, had the courage and the vision to pull the Alliance together. Out of that, obviously, came assistance from the Berger Commission. The Alliance came together for some basic reasons. One was to preserve and enhance health care for this region. 2, keep both hospitals open and respect the individual missions. That was specifically stated as part of the Alliance. Truly unique in the world of healthcare. That's why we were referred to as the poster child of the Berger Commission, because this community embraced the essence of the challenge, combined the two, keeping both open. And as a result, preserve jobs, not a job loss to a reduction in force. In fact, we created some in the ensuing months. We also, per the Berger Commission, reduced beds. Went from a total of 382 to 300, with each of the 2 having 150 licensed beds for purposes of distributing the care in a way that can better serve this community. And as a result, balance and keep both open. The end of 2008, the economy collapsed. In years past, I've been in this business over 30 years now. During recessionary periods, healthcare grew because people under stress, etc., sought medical care. That was the previous recessions that I was a part of. Not this time. It's been said many times. In the past, healthcare and education were immune to recessions. This time it hit all of us, and it hit us deep. Everyone in this room has been affected by the collapse that occurred back in 2008. We didn't feel it until the end of 2009. But we felt it, as have you. I don't know of any business that has not been required to redefine itself as a result of the changing economy. We're no different. We just happen to be the largest employer, and a bit complex when you look at all the services that are a part of our service package to this community. But we're not immune to the changes that are needed. Also, the healthcare industry, along with the economy, all of a sudden decided to change what it had been talking about for decades without any significant action. And in the last 3 years, I've seen more significant change than I have in the previous 30. Initiated by the reform movement and the subsequent changes that the Medicare system needed to do in order to survive over the long haul. And it does and has affected us significantly. Just some facts. Moody's Investor Services recently downgraded the nonprofit hospital sector to a negative outlook. More reimbursement cuts are coming. Hospitals everywhere are cutting. We're not the only ones. 6,300 layoffs in the New York State alone in the last 2 years. Until recently, we did not. This is a scary fact. According to the Employee Benefit Research Institute, workers with medical coverage through employers is at 51%. So coverage obviously has been affected. Demand has declined. Now these are all changes in the last 2 to 3 years. More clearly and most significantly the last 2 years. Many patients are putting off elective procedures because they can't afford it, or for other reasons choose not to pursue elective care. Payer incentives away from hospitals. Many of you have been faced with this. If you can go to another facility, including a physician office, and get the same procedure, same physician, with a $50 copay versus a $200 copay if you come to the hospital. Now we don't necessarily have direct control of that. We can drop our rates to match what the doctors do, but remember, the physicians are not open 24/7. They don't provide care to those that are the sickest 24/7. The physicians are doing what they have to do to survive going forward. That's part of the industry shift. I wish it wasn't that way, but in order to support our physicians, we're reaching out to them in ways that we can help them do that so that we can be available for the patients when they need the most severe care. That's part of the new world, and we must adjust with it. In 2010, Ulster County's total inpatient discharges were down 3%. 2,000 fewer outpatient surgeries, down 8%. we incurred a $2.7 million loss in 2010. Now that also carried with it some financial adjustments for depreciation and others, because we had $25 million of capital projects that we had to depreciate. 2011, we began to see further deterioration. Inpatient volume firmed up. Our inpatient volume has been steady, and we've seen some growth in comparison to 2010. We feel that going forward, with the changes in the demographics, even though there are incentives to keep patients out of the hospital, with the baby boomers hitting, living longer with more health issues, we will be able to stabilize. We do not see treating any fewer inpatients going forward. So our role is adjusting. On the flip side, where we had 50% of our revenues over many, many years coming from outpatients, we've seen a cliff-like decrease in outpatient services for the reasons that I described. People electing not to do it, procedures going out of the hospital. In 2011, that was over a $5 million decline in revenue. It's real. This is not a cyclical dip. It is an industry shift. Now, these are all things that have occurred in the last 2 years. Another important factor for this community. Between Medicare and Medicaid, 60% of our health business is funded through Medicare or Medicaid. That is higher than the surrounding communities. Now, get back to the favorite topic that comes up in every meeting I have. At that level, the MSA and the wage index takes on a huge impact. $10 million a year. Now, there have been many efforts to address that over the last 8 years. We've accelerated it. The latest proposal sitting on the desk of the Deputy Director of the CMS, quote, "We have convinced him personally and his staff that we are the worst wage cliff in the country. The Kingston hospitals are the worst. Due to the political environment, it cannot be advanced at this point." But it's not over in my mind. But it's not in the foreseeable future. The mandate is that we cannot continue to operate the way we've operated in the past. Doesn't work when you're operating at 70%. We didn't create that. That's the forces outside of us. So we didn't create the problem, but it is our problem. And it's up to us to work together more than ever to be sure that this community gets the best health care that it deserves. We need, though, to become better and stronger, we need to shrink some. We're so spread out at this point that we can't truly support the services that should be provided to this community. So, our job is tough, but we have a very, I think, solid team of people. We need to pull together. We need for our community to stay home, to receive the care. Check it out before you go north and south. And if it doesn't meet your standards, call me personally. Over the next several weeks, we'll have some preliminary idea. But it is important so that we can answer your questions. that we be allowed to get the facts so that we can work with you and all of our community leaders. What we do know is that we must change. We got two choices. We can ignore all the factors that are changing and shut the doors entirely to this community. Or we can step up, take it seriously. It's not a pleasant journey. It's tough. But hit the challenge head on. Working with our boards, our physicians, the sisters, our employees, our elected officials, because we do believe, honestly, there are some opportunities for relief out there, and I think we do have a very compelling story. Regulatory agencies, and of course the general community. That's our responsibility, and as I said earlier, we take that very seriously. We are exploring any and all affiliation opportunities and partnerships. We are a bit unique in that we have a partnership with a payer. CDPHP is a partner of ours and is helping us work with our physicians and integrating better with our physicians, as well as being a payer to our organization as an employer, and is working with us to develop a community health model to better serve this market. That's not excluding the MVP or the Empires or the others. It's just that they were willing to step up and work with us. Truly unique. In years past, that was a line never crossed. We're working with other hospitals in ways to share services, share resources, link. One of the things that we knew coming into the Alliance is that it was never an end result. The Alliance was the first step for this community to align with and become a part of something bigger. But you don't have to sell your soul. You can align, you can partner, you can bring value to a relationship that is valued by a larger entity. There are efficiencies that can be gained from that, and we certainly have been and will continue to pursue those opportunities. So, I don't know if this has been helpful to you going forward. I can tell you that it is tough, it's scary, because we don't yet know what that future looks like yet, and probably won't know for a period of time. But if we work together and support each other, we'll get there a heck of a lot sooner. And by that I mean, challenge us. Stay home. Expect the best. Let us know what your thoughts are so we can better serve.